This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Most people are unaware that the most common sexually transmitted infection in the world is a silent killer.
Cervical cancer is the cancer of the cervix, which is the entrance of the uterus. Okay? Or in layman's term, it's the kwelyo ng matres.
Cervical cancer, caused by the human papillomavirus or HPV, is responsible for the second most common cancer among women.
Easily transmitted through sexual contacts, okay? But not necessarily with intercourse. Just rubbing of the skin can already it's very easily transmittable.
According to the World Health Organization, 12 Filipinas fall victim to cervical cancer on a daily basis, with 250,000 fatalities recorded worldwide every year. Most people don't pay attention, since the early symptoms of cervical cancer do not manifest right away.
3 out of 4 diagnosed with cervical cancer die within 5 years.
Early detection is ideal, since treatment will most likely be more successful. The best defense against cervical cancer is prevention.
It's very, very much preventable because it's an infection. Okay, so you prevent the infection, then you don't get a disease. So how do you prevent it? Through vaccination.
Today, there are vaccines available against various types of HPV, not just for women, but also for men. What are the different types of cervical cancer? How can you detect HPV? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Cecilia Ladines-Llave, President of the Society of Gynecologic Oncologists of the Philippines and the Chairman of the Cervical Cancer Prevention Network and the first woman chair of the UP-PGH Cancer Institute. You may join our discussion by calling our hotline at 548-4678. March is Women's Month, so tonight, Doctor, to our viewers, we'll be talking about the different health concerns, the different health issues that women face. Yeah. Let's start off by talking about cervical cancer. Please help us understand the role and the function of the cervix in our bodies.
The cervix is what you call kwelyo ng matres. So it means it is an organ which is connected to the uterus, which is the house of the baby. Yun yung matres. So this organ is very important as a sphincter opening where your menstrual blood comes out. And this is also the organ which opens and dilates so that the baby can come out. So it's a very important organ because in the process of giving birth and giving life, it's a very important organ that opens up to the world. Okay? It's also an organ which protects infection, so that the infection that you have in the vulva or in the vagina will not go up in the uterus and in the pelvic area and in the abdomen. So it's a protection, and at the same time, it produces a mucus which can serve as a lubricant. So the cervix is a very important organ of a woman. You don't have a cervix for man.
Okay, what is the counterpart of a cervix, the cervix of a woman for the male?
Well, for the male, you have the penis, okay, and the scrotum, isn't it? But for the woman, you have the vagina and the cervix. So when you talk about cervical cancer, it's only a cancer for women.
And when we talk also, getting more into understanding and then knowing more about the cervix and its function, how do we know, or what is the feeling of someone who has a a healthy cervix? How do we keep it healthy, clean, and free from infection and bacteria?
Okay, so first and foremost, you do not feel any abnormality like bleeding, abnormal discharge, or pain, or signs and symptoms that would be referable to the urinary or gastrointestinal system, because these organs are very near the cervix. So if you are standing on the lateral aspect, you will have the bladder in front of you and opens to the urethra. The woman has three openings: the urethra, the vagina, and the anus. Okay? And they're very near each other, such that the roof of the vagina is the floor of the urethra, or where your urine comes out. So if you have a lesion in the cervix that would push the urethra or your bladder, you will feel signs in the urinary system.
Well, this is when you feel there's itch or a burning sensation every time you urinate.
Yes. And sometimes if you have infection of the urinary system, the culprit might not just be your urinary system, but in your cervix or in your uterus. And the floor of the vagina is the roof of your rectum.
Yes.
The anal, and it goes out into the anus. So if you have a lesion in the cervix or a mass that grows so huge, it can affect your bowel movement. So what I'm talking about are signs and symptoms already of late cancer. But the thing is, even if you have a late cancer in the cervix, 18% of the time there are no signs and symptoms at all. And so all of a sudden your neighbor will say, "Naku, si Mare, na-diagnose cervical cancer, kaya lang talamak na. Eh, ba't ganun, taba-taba naman, tapos bigla namang naging mahina siya agad at namayat in just 1 month." It's because it's a silent killer. And you will have the signs and symptoms only if you are already in the late stage. And what's so ironic is cervical cancer is a disease that can be treated if they are diagnosed very early, at a stage when it's still pre-malignant. And it can be prevented because it's a disease where we know the cause of cancer.
So we can backtrack a little bit, doctor, and go to the primary cause. We'd like to get down to the root cause of an infection in the cervix before it can be diagnosed as pre-malignant or malignant and can lead to cervical cancer. So what is the root cause of an infection in the cervix?
Okay, the cause of cervical cancer is an infection you call a virus, which is human papillomavirus, or warts. In Tagalog, kulugo. Can you imagine that you have kulugo in the face, in the neck, in the hand, in the breast?
Kulugo
But
is
my
common.
God, yeah, it's so common.
Yes.
But for me to have kulugo there in the vagina or in the vulva, in the cervix, parang so devastating for someone, no? Because it's just a simple infection. And yet, 13 to 15 of the types of these warts or this HPV can cause cancer. But before an infection of the cervix becomes cervical cancer, it takes 10 to 30 years, meaning it has to be a chronic, persistent infection. 99.7% of the time, the cause of cervical cancer is the virus, which is sexually transmitted. But you can imagine the long period of time before it becomes malignant, 10 to 30 years, which only means that a doctor can immediately pick you up if you are already having lesions that are pre-malignant long before you even have signs and symptoms of that disease.
So a doctor can pick you up if you go for a consultation, if you go for a screening or the regular checkup that you must have as a woman.
But if you do not, the doctor will not be able to pick it up. A lot of times, we think about fine-tuning. You have a car and you wanted your car to be fine-tuned because you want it to be repaired all the time so that you are sure you will not have an accident, isn't it?
Yes.
So why can't we do that for our body? That's why a lot of the corporate world would make sure that the employees will be checked from hair down to the toe when they become already like 30 years old or as soon as they become employees, because I want to be assured that my employee will be very effective in doing his job. By being very healthy, I can do a lot of work, but I am not healthy, then my investment on you will really bluff. So it's very important that you, as a very good citizen, should make sure that you are healthy. And may HMO ka naman, meron ka namang
walang
benefit, di ba?
Na hindi magpa-check up.
Yes. So even if you're not feeling anything, especially if you're already 35 years old or 40, medyo malog ng tornilyo mo, and you already have rust, so have a fine-tuning. Don't wait for signs and symptoms to come. The thing is, with cervical cancer, you have a screening tool. Long before you have signs and symptoms or long before you have a buccal, you can already detect that that woman is shedding cells that already has cancer. And it can be seen through the microscope. You call it pap smear. Yeah. And so for developed countries like US, Canada, Australia, they have very good screening program using the pap smear. And for the past many years, they have shown that the pap smear had decreased the incidence of cervical cancer to 90% and the mortality rate to 70%. And less women are diagnosed with cervical cancer. But the problem is, for developing countries like the Philippines, we have not attained that kind of success. Why? The pap smear has limitations. If you look at the Philippines, we're only able to screen 7% of our women. The reason for it, pap smear is very expensive. Not a lot of women knows there is a screening tool. We don't offer it in all our health centers. Only 42 of the health centers have available screening program. We don't have pathologists and cytoscreeners to do the job. And a lot of our women are not really able to go to the health center. So it's important that we are able to screen this woman using the pap smear. But pap smear is very expensive. So John Hopkins started the advocacy in the Philippines to offer an alternative to the pap smear, and this is using the ordinary vinegar.
So doctor will talk about using the ordinary vinegar, which I understand is not as expensive as getting the regular pap smear. All that and more about cervical cancer when MedTalk returns.
Did you know that according to the Annuals of Behavioral Medicine, women who felt more stressed were more prone to HPV? Stress, as maintained by researchers at Fox Chase Cancer Center in Philadelphia, can in fact affect the body's ability to combat HPV.
We're back here on MedTalk, still talking about cervical cancer. Doctor, before we cut to the break, we were talking about acetic acid, suka, as an alternative to your pap smear. How does this work?
Okay, the acetic acid, you place the acetic acid in the cervix for 1 minute.
I can do that.
No,
we can do that.
It's a
The
doctor
has to do
or
that.
health provider who can do it.
Okay.
So it's just like having a pap smear, being in a lithotomy position and placing the speculum, visualizing the cervix. But this time, for the pap smear, you swab the cervix, isn't it? And put it on the slide. But for acetic acid, after visualizing the cervix, you put in a cotton pledget the acetic acid or the vinegar, which is 3 to 5% only. More than that, you're going to burn the cervix. So you put the cervix, you put the pledget with the suka into the cervix, And within 1 minute, you have a result. Immediately, you have a result. So after putting suga, Lou, you will see if it's positive, there will be a whitening of the area, which is abnormal. And if it's negative, there won't be any whitening.
Positive meaning?
Positive for a lesion in the cervix that might become malignant. But of course, the first thing you have to do is entirely rule out if there is any lesion that looks malignant.
Before the actual application of the vinegar?
Yes, because if it's suspicious for cancer, you have to immediately biopsy. If it is not suspicious for cancer, you can do your acetic acid test. And in 1 minute, you have a result. Now, if the lesion is small, less than 75% of the cervix, it doesn't enter the cervix, you're sure it's not cancer, it doesn't go to the vagina, you're assured that you can treat it immediately. In 12 minutes, the doctor, the nurse, or the midwife in the health center can immediately treat the woman putting cryotherapy. Cryotherapy is putting ice into the cervix, making it like a frozen delight.
Okay.
So what happens is you kill the cells with ice and freeze it like it is frozen.
Okay.
Let it go.
Let it go.
Yeah.
Okay.
Okay. And then what will happen is that area with the lesion will slap off. And after 3 to 4 months, what you have is a very smooth cervix without the lesion anymore. Okay, bellow essentials. So the cervix will now be very smooth, no lesion. It's like a virgin.
Oh,
yeah.
So immediately you will see the results because you said upon diagnosing that there is an infection or a lesion, it takes 12 minutes. Shortly after that, you freeze it, falls off, and then after a while, it's like new.
Yes, and you counsel the woman that she can return within 3 months for you to double check her, okay? And repeat the screening after a year.
Is it guaranteed?
Using the acetic acid.
Is it guaranteed that using the acetic acid that the HPV or the virus or the lesions will not come back?
No. It's only a screening tool or test. But once you have totally treated that woman, the cervix becomes new. And at any one time, you can get reinfected. Because natural infection does not mount a very high immunity so that you will be protected compared to vaccination. When you have vaccination, there is an assurance that you're immune and you cannot get that infection anymore. It's a prophylactic vaccine wherein it's best given to you when you don't have the disease.
Doctor, we speak of given to you, given to a woman. At what age and who are prone to getting cervical cancer and who should get the vaccine or the acetic acid
Every woman
test?
is at risk of developing cervical cancer because any woman who is sexually active can have it. So the advice of the WHO is start the vaccination from 9 years old. The beginning age is 9 to 13 years old. But you can have a catch-up age, maybe at 26 years old, as long as you don't have the disease.
But at 9 years old, for a parent, you're a bit
worried
skeptic, but worried at that young age, not even a teenager yet, and a vaccine will be administered.
Right. So you do not only get the assent or consent for the child, but you also get a consent of the mother or the father. So that, because they're still minors, and so you need the consent of the parent before you vaccinate. But the best time to vaccinate is at this adolescent age, because this is the best time where you mount a very high immunity and the protection is better. But vaccination is not 100% assurance that you will not get the disease, because the vaccination is only very good 70 to 80% of the time, because it only covers type 16 and 18. And there are 13 to 15 types of HPV that can cause cancer, but it's not yet available.
So it's only 13, am I correct?
It's only type 16 and 18. which will make you protected.
Okay.
So, which is only 70 to 80% of the time.
The rest of the 20% or the 30%,
That is why we are emphasizing that it's not only vaccination which will be your tool for prevention. You should have early detection using your screening, pap smear, or acetic acid wash. It has always to come together. Screening, linked to treatment, and vaccination. So for primary prevention, you have healthy living, which boosts your immunity so that you will be protected not to get the cancer, and vaccination. And early detection of cancer, diagnosing you early so that you can be treated so you will not get the disease. So this is where your screening comes in, which will be linked to treatment using your cryotherapy. In a single visit approach.
But this is upon diagnosis of a lesion or an infection already?
Yes.
Okay. But
yes.
You mentioned that if one is not sexually active, then the risk of getting cervical cancer is nil.
Not exactly nil, but because the way to get the HPV infection is not exactly just having sexual contact and penetration. You can have sexual contact and get it, or you can have from hand to the genital, not only genital to genital, mucus to mucus,
yes.
Okay, or hand or skin to skin, but you can get it from fomites, you can get it from garments, you can get it from other things. When they even say that the virus in a dead tissue can still live, and even if it's just in the toilet bowl, can swim up your mucus in your genitals and go up and become infected.
To hear all these things, you get a bit worried, and you, as much as you'd want to live a healthy lifestyle, you can't really take note of all of that at the same time. But doctor, we have a caller on the line, Cha. Hi, Cha. Good evening.
Hi, good evening.
Yes, please go ahead with your question for Dr. Cecilia.
Hi, good evening, Doc. Yes, I would like to know if I'm prone to cervical cancer because I was bleeding abnormally for almost years. And recently, I've already consulted an OB-gynecologist. I was diagnosed with endometrial hyperplasia. Is that correct?
Yeah. Okay. So you are having problems with abnormal bleeding, which has become persistent and chronic. And I understand, did you have a fractional curettage? That's why you were diagnosed with hyperplasia.
Cha?
Yes, Doc.
Yeah, you had a curettage. Meaning they scrape your uterus and your cervix, and they biopsied it, and it turned out to be endometrial hyperplasia. Is that it? Or you never had yet a curettage?
Oh, okay.
Because if you're bleeding abnormally and you're still very young, and the doctor is quite sure that you're bleeding because only of a hormonal problem, you don't have, meaning the doctor examined you, looked into your vulva, vagina, and cervix, and uterus, and all the pelvic organs, and she did not see any lesion at all, then maybe, and she's quite sure that from your ultrasound there are no masses, there's no thickening of the endometrial lining, and then she's quite sure that it is not malignant, then she can go ahead and treat you as a case wherein you have a hormonal dysfunction, and you can be treated with hormones. And it takes some time to really treat you if you have a hormonal imbalance. But if you're a lot older and your ultrasound or findings would show that the doctor wants to really rule out malignancy, therefore you need a biopsy of those lining of the reproductive organs so that the doctor is assured that you don't have any malignancy that needs to be operated, that needs to be treated. So I guess maybe you're just having a hormonal problem, unless you were saying it's hyperplasia, so maybe the doctor did a biopsy on you already or not yet? It's just an impression.
Not yet, but I'm going undergo DNC.
DNC.
DNC, yes. DNC is a biopsy. It's also curettage. The difference of dilatation, DNC is dilatation and curettage. But if it is for biopsy, you call it fractional curettage because you scrape the cervix in the endocervical canal, you scrape the endometrial lining and try to see if you have lesions there that might become malignant. Hyperplasia is benign, and it only means that this is related to a hormonal dysfunction. If it is hyperplasia with atypia, these are the ones, which is complex, these are the ones which might cause lesions that might become malignant. But yours is just hyperplasia. So you just need to be monitored very closely, and the doctor will continue to treat you as a hormonal dysfunction case. The best is close monitoring, and as long as the doctor had the biopsy to show that you don't have any malignancy, you should not be very worried. But I can understand if you continue to be bleeding, it becomes a huge problem, and you don't know anymore what's happening to you.
Yes, and Cha?
Yes.
Would that be all?
That will be all. I really appreciate the explanation that was given by Doctora.
Yes, yes. Thank you, Cha, and take care.
Have a nice evening.
You too.
Thank you.
You know, you can't help but be worried if you keep bleeding, and the lesion or maybe an infection can mask a hormonal imbalance.
Yes.
Okay, so it's really advisable to screen and seek the medical
that's why
advice.
she had a dilatation curettage, and but actually it's a biopsy
already
to rule out malignancy.
Okay, doctor, we have a question from Facebook from Frias Lori. The question is, can LSIL develop the cervical cancer? LSIL.
LSIL means it's a low-grade type of squamous intraepithelial lesion. It's a continuum of pre-malignant lesion.
Okay.
So actually, diseases of the cervix goes through a process of a continuum. You start from normal cervix, and then you have benign changes. Then if you have infection, okay, your infection can get well. Okay, it can graduate into pre-malignant lesions. For pre-malignant lesions, they are divided into low-grade and high-grade SIL, S-I-L.
Okay.
S means squamous intraepithelial lesion. It can be low-grade, meaning the chances for it to become malignant is very low. And the chances for it to regress and you get well of it, even without treatment, will be there. The chance for it to become malignant is low only, about 15 to 25%, compared to a high SIL. High SIL is high-grade type of intraepithelial lesion, meaning the lesion is only in the lining. That's why intraepithelial. It means it can be sloughed off, and you can get well of it without treatment.
Is it the cryotherapy that you mentioned that's sloughing off? Can that
yeah, it's or it can slough off by itself.
Okay.
Because that lining gets to wear off, especially when you're menstruating. So that lining can go out with a flow of blood that comes out. Okay, but for a high-grade lesion, these are the ones which are more prone to develop into malignancy compared to a low-grade. So the chance for LC to become malignant is very low.
Okay, that's good to know, doctor.
Yes, and some women get well without being treated for it because it can be sloughed off. It's something like an HPV infection can live with you forever without you getting sick if your immunity is very high, and it can go away without you being treated for that.
You mentioned that if your immune system or immunity is very high. We'll talk more about cervical health, cervical cancer when MedTalk returns.
Did you know that cancer can take years or even decades to appear after a person is infected with HPV? The warts caused by HPV can in fact appear months after contracting the virus. Life has never been the same after Josie De La Cruz was diagnosed with cervical cancer.
I just cried and cried and cried, and then I just asked God, bakit naman Lord, pati ako? So, kinuha mo na nga yung nanay ko, but eto pa, pati ba ako? My mother was 48 when she passed away because of cervical cancer.
Nothing prepared Josie for cancer.
Parang irregularities, especially in the menstrual cycle. I used to have only 5 days, yung usual flow. However, parang tumatagal siya. It became 7 and parang may 8, 9, sometimes 10, and then during intercourse, parang ganon, merong konting bleeding.
There were no known vaccines for cervical cancer back then, so she was most especially worried that her daughters might get it too.
The pressing question was, Mommy, mamamatay din ba kami sa cervical cancer?
It has been a tough battle for her, but the key was finding the necessary support group and professional help.
I went through radical hysterectomy, that was the surgical procedure. I was given 26 sessions of radiation therapy.
Cancer-free and truly a survivor, Josie now heads the Philippine Cervical Cancer Association of the Philippines. Her goal? To encourage women to get the vaccine to prevent cervical cancer.
I always say that it is more expensive. No, it is more expensive when you get the disease already. It's a lot cheaper when you get the vaccine.
We're back here on MedTalk, still talking about cervical health, cervical cancer. You may join the discussion by calling our hotline at 548-4678. Dr. Llave, she's a strong woman, Josie, who was diagnosed in early 2000, and there were no vaccines available then.
During the time.
Yes.
And she's a very empowered woman. Yes. Initially, she was very afraid because it's the mother died of cervical cancer at the age of 48.
48. Is it hereditary? Because her mom died of
actually,
cervical
it's
cancer.
not exactly hereditary, but because of the immunity, which is very familial, the same immunity that the mother has will be for her the same. So it only means that the immune system is not so strong.
Hence the concern
Hence
of her
the concern
daughters
of the
also.
daughters, yes. But compared to breast cancer, because for breast cancer, if your mom has breast cancer, your chance of having a breast cancer is 50%. If your aunt has it, your chance is 25%. That is the reason why, remember, Angelina Jolie
yes,
decided to have her breast removed because she's positive for the gene that will cause cancer. So even if there are no lesions, she had a breast removed.
Okay.
So for cervical cancer, it's not that high. However, because it's a familial, the immune system of the family is the same, your immunity to get the disease is it's low. So maybe that's the reason why she also has it. But it's not really true that it's very hereditary and cervical compared to the breast.
right. But
Right.
during the time when she was diagnosed, no vaccines were available. So
No.
how did that go? How was the treatment like during the time? I understand she's your patient.
She was diagnosed early because it's only stage 1. But the mother was not very lucky. It was a late stage. And the reason for this is because she's a very knowledgeable woman. She's a professor.
As you mentioned, empowered.
Right, she's a very empowered woman, and she knows if there are abnormalities. That's why she went to doctor early, so that she had a surgery. You can only have surgery for cervical cancer if your disease is at the early stage.
Okay, so
But if it's a late stage, you cannot be treated with surgery because you will not be able to get the whole cancer because it had already extended down to the pelvic wall near the bone.
Okay.
So only early stages can be operated.
So what is removed from the cervix that causes the cancer at stage 1?
Yeah, you remove the cervix, the uterus, part of the vagina, the parameter area on the sides that goes to the pelvic wall here. Those are removed, and even the nodes on the sides, because you may not have any lesions on the sides, and yet you already have cancer in the lymph node, because it can travel through the blood and through the lymph node. So it doesn't always mean that you have cancer here in the node that you will have cancer on the sides.
Yes.
Sometimes the lesion would start here, and yet it would flow to the lymphatics without affecting the tissues near it. She's very lucky because she was operated. She was in an early stage. If you're diagnosed early, your chance to get cured is 95% for stage 1. But as it goes down to stage 3, your chance to get cured is 60%. And as it goes down to stage 4B, your chance is only 15%. So the lesson here is cervical cancer is a disease that can be treated only when they are diagnosed early.
So when is it? When are you supposed to go to your doctor? When is it diagnosed early?
Okay, that's a very good question. Now, all women should know that you can get that virus and cause that infection and can develop into cancer. So the advice of the American Cancer Society is 3 years after the first sexual contact, or at age 21, even if you have no sexual contact, you should have screening with a pap smear or acetic acid wash.
Is it common for women to get a pap smear or the acetic acid wash? Is it in their consciousness? Is it in their lifestyle? Is it in a habit?
That's a problem because in the Philippines, only 7% had been screened.
7%?
Only.
Why is it so low?
Because a lot of women doesn't know that there is a pap smear, there is acetic acid wash.
Now we do. Thanks
No,
to
you do, but
yes.
who is watching the TV? Who
We
is
hope
reading the
that they're
Facebook? If I live in the countryside, in the mountains, what I have is only the radio.
Yes.
I don't even have the radio sometimes. And a lot of women will tell me, why should I go to a health center? Before I go down to the health center, I have to ride a jeep, which is 150 pesos. Which only means, Doctora, I will not sell fish today because I have to go down to the health center to have a pap smear or a screening acetic acid, even if I'm not feeling anything, and would only mean I will not be earning money for the food that I have to eat tomorrow. So why should I go
It's
there?
not a priority then.
Yes.
It's not. But
Yeah.
how do we make it a priority? How do we encourage and educate everyone to make it a priority?
It should be educating the people in the local government, making them empowered and teaching the women that it's important for the woman to be healthy. Women are very important in this country.
Yes.
Why? Because women have so many roles. They are not only sisters, they are daughters, they are lovers. There are wives who's going to clean the toilet. And when I talk of cleaning the toilet, woman does not only literally clean the toilet of the house, but clean the toilet of the family. What I'm trying to say is woman is very important because they are mothers. Who is going to take care of your children? And so women is very important for them to be empowered so that they will always be healthy.
And MedTalk is a tool in empowering women and
Yes.
everyone in society to take better care of their health. And that's what we will talk more about rather, when MedTalk returns. We're back here on MedTalk, still talking about learning more about cervical cancer. And we have a caller on the line, Dr. Cecilia. Hi, Marlene. Good evening.
Hi, Marlene.
Ay, magandang gabi rin po.
Magandang gabi sa'yo. Yung question mo para kay Doktora, please.
Tanong ko lang po sana kung kung kapasaksak po ng injectable po doon sa cervical cancer, posible po bang wala na po ba yun?
Marlene, pasensya na ha, hindi ka namin masyadong marinig. Pwedeng pakiulit na lang nung tanong?
Ang tanong ko po, kung halimbawa papasaksak po ako ng cervical cancer, hindi na po ba ako magkakaroon po ng ganong klase ng sakit?
Marlene?
Po?
Pasensya na, isa na lang na paulit lang ng tanong. Medyo nag-choppy ka ng konti, so kung pwedeng maulit mo lang yung tanong mo.
Opo.
Ayan, salamat.
Ang tanong ko po, kung magpapasaksak po ba ako ng cervical inject, posible po bang wala na po yung layon sa mattress?
Okay, so ang tanong mo ay tungkol sa vaccine, kung effective ang kung magpapa-vaccine ka na makaka-prevent or avoid ng cancer or infection sa iyong matres, tama ba?
Opo.
Salamat, Marlene.
Okay.
Dr. Cecilia.
Ang bakunang available natin ngayon ay very protective for 2 types of the HPV that can cause cancer. There are 13 to 15 types that can cause cancer at the cervix. So, and we are only able to give a vaccine, 2 types of vaccine, 16 and 18.
Ito yung pwedeng kunin ni Marlene.
Oo. And these 2 types of vaccine can cause cervical cancer 70 to 80% of the time. So your protection is not 100%, only 70 to 80%. Okay. But that's good enough rather than no protection at all. And it only means that in order for you to be protected from cervical cancer, it's not enough that you just have vaccination. You should continue with having screening or monitoring yourself, having that pap smear or acetic acid was as a screening for you to know whether you have signs that are showing that you are developing an infection or cancer already. Because the vaccine that we have can only protect you for the type 16 and 18, which will only provide you 70 to 80% of the time.
So, it's a start na magpabakuna na si Marlene. And
Yes,
all our
pwede na
other
siyang
women viewers out
magpabakuna,
there.
but do not forget that you still have to be screened regularly.
Okay. Alright. Salamat, Marlene. Salamat.
Thank you po. Magandang po.
Okay. So, screened regularly. We know what causes cervical cancer. We know how to prevent it. We can't emphasize enough the care that we give to that particular body part, because knowing what can cause cervical cancer, then it's best that we address it right away.
Right. That's why developed countries, I can give you cite model countries which had already decreased the incidence to as much as 90% and the mortality rate to as much as 70%. One very good example is Australia. Because a very organized screening program, meaning most of their women, when they become sexually active, 3 years after that, they have a regular smear, and they followed up very closely because they have an insurance that would really demand that they have that regularly. And so they're able to pick them up very early, long before they even become malignant. So less and less women are diagnosed of cervical cancer. They are diagnosed as pre-malignant lesion. Now, because they already have vaccine, they started to already vaccinate children. All children at the age of 13 for Australia, they have vaccinated all the children in school, HPV vaccination. For Britain, they have vaccinated all 12 years old for several years already. And Australia, after several years of vaccinating the women who are 13 years old, have started already vaccinating the males.
Even the males, why is, because they're the carrier of
Yes.
the HPV virus.
Yes, and the purpose is for you to really cover up that group of, it's like a herd immunity. So you develop an immunity to your population who will be at risk to developing that infection.
You mentioned cover up. You mentioned cover all bases,
cover
so
all
to speak.
bases.
Now, when one has been diagnosed with a disease, with cervical cancer, in covering all bases for recovery, for you to be well and healthy and perform your duties, responsibility as a woman, what are the treatments that are available?
Okay, as I was saying a while before, surgery is only for early stage, up to selected cases of 2A.
Okay.
For cases that are more than 2A or more, you cannot do surgery anymore. And
why is that?
Because the lesion is so widespread, you are not assured that you will be able to get the whole lesion, no? And because when you do surgery for cancer, you have to take care of a certain border that is still negative for cancer. It is something like you have to be assured that you're not leaving any cells behind that
Still
already have
covering
cancer.
all bases.
Yes.
When you do the surgery.
Right.
For until 2A.
Until selected 2A.
Selected 2A. What about the
for
other
more
types
than,
of cancer?
For 2As or more, then you have to be chemotherapy plus radiation. So it's chemoradiation. And then you reassess afterwards if you've totally removed the lesion, because if there are still remnants of your cancer, you still have to continue treating them.
What is the effectivity of surgery and radiation and chemotherapy?
Well, the effect of surgery and chemoradiation is the same. So whether you do an operation or chemoradiation, they are both very good treatment. But for early stage, the chances of getting cured, whether surgery or chemotherapy, is 95%. For stage 3, it goes down to 60, and for stage 4B, it's only 15%. So the earlier diagnosed, the better it will be. Our experience is the older they are, the better chances for them to get cured.
Why is
The younger
older
ones sometimes do not, the type of the cancer they get is more deadly.
Why is that? Why is it that the younger
We cannot
ones...
explain it really, but we could not find any reason. But I think it has to do with hormones.
Okay.
Because an old woman, wherein a menopausal, will not have hormones anymore. And as part of the, one of the possible risk factor is the use of estrogen. They say that if you use estrogen, the higher is your risk to develop the cancer. So maybe it's related to that, but it cannot be pinpointed as yet. We don't know yet.
But we can pinpoint the cause of cervical cancer. We can pinpoint what can be done about it. What would be your final words or final advice to all our viewers out there, Dr. Llave?
Well, cervical cancer is a disease where we know the cause. It's a virus, it's an infection, it's sexually transmitted. And therefore, knowing the cause of cancer, we know now that it is a disease that then be treated only when they're diagnosed early. It's a disease that can be prevented through healthy lifestyle and vaccination. So it's the greatest breakthrough of our time, to know the cause of cancer. There are only 2 organs in the body for which we know the cause of cancer. For hepatocarcinoma, we know that it is related to your hepatitis B virus, and that's why in Taiwan, following a massive vaccination for hepatitis B, there was a tremendous decline in your hepatocarcinoma.
Okay, that's one.
Yes.
One that we know of where it comes from and how to cure it.
And the odds ratio of its effectivity is like a 60 times. But when you talk about cervical cancer, which is caused by a virus 99.7% of the time, the odds ratio is very high, 600 times. Because in terms of cause and effect, WHO had long announced the cause of cervical cancer is chronic and persistent HPV infection of the high-risk type.
And here, Doctora, on MedTalk, if you mention the word chronic, we will keep repeating that again, prevention is key.
Yeah.
We know the cause and we know how to prevent it. Thank you very much for enlightening all of us and on cervical health and how to prevent this disease from coming to a woman, from us getting it. Thank you very much, Doctora. Once again, we'd like to thank Doctora Cecilia Ladines-Llave for, again, as mentioned, enlightening all of us about cervical cancer, about cervical health. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on the Solar News Channel. This is Angel Jacob. Good night. You urinate.
Yes. And sometimes if you have infection of the urinary system, the culprit might not just be your urinary system, but in your cervix or in your uterus. And the floor of the vagina is the roof of your rectum.
Yes.
The anal, and it goes out into the anus. So if you have a lesion in the cervix or a mass that grows so huge, it can affect your bowel movement. So what I'm talking about are signs and symptoms already of late cancer. But the thing is, even if you have a late cancer in the cervix, 18% of the time there are no signs and symptoms at all. And so all of a sudden your neighbor will say, "Naku, si Mare, na-diagnose cervical cancer. Kaya lang talamak na. Eh ba't ganun, taba-taba naman, tapos bigla namang naging mahina siya agad at namayat in just 1 month." It's because it's a silent killer. And you will have the signs and symptoms only if you are already in the late stage. And what's so ironic is cervical cancer is a disease that can be treated if they are diagnosed very early, at a stage when it's still pre-malignant. And it can be prevented because it's a disease where we know the cause of cancer.
So we can backtrack a little bit, Doctor, and go to the primary cause. We'd like to get down to
the World Health Organization, 12 Filipinas fall victim to cervical cancer on a daily basis, with 250,000 fatalities recorded worldwide every year. Most people don't pay attention, since the early symptoms of cervical cancer do not manifest right away.
3 out of 4 diagnosed with cervical cancer die within 5 years.
Early detection is ideal, since treatment will most likely be more successful. The best defense against cervical cancer is prevention.
It's very, very much preventable because it's an infection. Okay, so you prevent the infection, then you don't get a disease. So how do you prevent it? Through vaccination.
Today, there are vaccines available against various types of HPV, not just for women, but also for men. What are the different types of cervical cancer? How can you detect HPV? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Cecilia Ladines-Llave, President of the Society of Gynecologic Oncologists of the Philippines and the Chairman of the Cervical Cancer Prevention Network and the first woman chair of the UP-PGH Cancer Institute. You may join our discussion by calling our hotline at 548-4678. March is Women's Month, so
The vagina and the cervix. So when you talk about cervical cancer, it's only a cancer for women.
and when we talk also getting more into understanding and then knowing more about the cervix and its function, how do we know, or what's the feeling of someone who has a healthy cervix? How do we keep it healthy, clean, and free from infection and bacteria?
Okay, so first and foremost, you do not feel any abnormality like bleeding, abnormal discharge, or pain, or signs and symptoms that would be referable to the urinary or gastrointestinal system, because these organs are very near the cervix. So if you are standing on the lateral aspect, you will have the bladder in front of you and opens to the urethra. The woman has three openings: the urethra, the vagina, and the anus. Okay? And they're very near each other, such that the roof of the vagina is the floor of the urethra, or where your urine comes out. So if you have a lesion in the cervix that would push the urethra or your bladder, you will feel signs in the urinary system.
Well, this is when you feel there's itch or a burning sensation every time. Tonight, Doctor, to our viewers, we'll be talking about the different health concerns, the different health issues that women face. Let's start off by talking about cervical cancer. Please help us understand the role and the function of the cervix in our bodies.
The cervix is what you call cuello matres. So it means it is an organ which is connected to the uterus, which is the house of the baby. Yun yung matres. So this organ is very important as a sphincter opening where your menstrual blood comes out. And this is also the organ which opens and dilates so that the baby can come out. So it's a very important organ because in the process of giving birth and giving life, it's a very important organ that opens up to the world. Okay? It's also an organ which protects infection, so that the infection that you have in the vulva or in the vagina will not go up in the uterus and in the pelvic area and in the abdomen. So it's a protection, and at the same time, it produces a mucus which can serve as a lubricant. So the cervix is a very important organ of a woman. You don't have a cervix for man.
Okay, what is the counterpart of a cervix, the cervix of a woman for the male?
Well, for the male, you have the penis, okay, and the scrotum, isn't it? But for the woman, you
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Most people are unaware that the most common sexually transmitted infection in the world is a silent killer.
Cervical cancer is the cancer of the cervix, which is the entrance of the uterus. Okay? Or in layman's term, it's the cuello ng matres.
Cervical cancer, caused by the human papillomavirus or HPV, is responsible for the second most common cancer among women.
Easily transmitted through sexual contacts, okay? But not necessarily with intercourse. Just rubbing of the skin can already it's very easily transmittable.
According